healthy aging, not an easy topic, because healthy aging has both its objective standards and its the subjectivities. But healthy aging refers to the fact of older persons being contented, being free of pain, physical pain I'm referring to, but also feeling happy with their lives and feeling that they have lived a good life, and even if they're relatively old, they can look towards the future with positivity. Healthy aging is quite a difficult topic to pinpoint because it differs from not only countries but even within countries, within the same regions, but even within people. And there are, aspects related to gender and to socioeconomic standing, education. I think also there's a big misnomer about healthy aging. We tend to look at healthy aging from a snapshot perspective. So, are you healthy now or aren't you healthy now? But healthy aging has to be looked from a life course perspective. The extent that you are physically healthy today would depend on your actions in the past. Another thing, also healthy aging, there's another word which is very important. We rarely mention it because healthy aging, sometimes it's hijacked by medical personnel. It's family. And family in the sense that once physical health and one's emotional health, one's psychological health depends on one's relationship with other family members, especially in the Middle East, but even in the Mediterranean region and even North Africa. Many people tend to reply to your questions in the plural, because we feel like that, because we are like that, and we tend to do that. And that is something also very important policy-wise, because policies on healthy aging, therefore, must take a wider view of the situation. First of all, it needs to take also a cultural view. And also put the family into perspective, but of course not making older people dependent on the family more than they perhaps already are, but ensuring that the issue of families does enter policy frameworks. So I think the crux here is to keep a balance between the individuality of the person and also his or her role in a type of social system, be it family, be it the country, etc. I think healthy aging is also slippery as well, because we do not want also to give the impression that all the people who are not healthy for some reason, they might have experienced stroke, they might have experienced dementia. It doesn't mean that they are failures, that they have failed in their lives. So we also have to also make it sure that we also speak the inevitability of physical and health problems, because we have seen that people who are healthy tend to be considered like heroes, like ambassadors of life, and people ask them, but what did you do? How did you make it? Then there are other people who perhaps may not be as healthy as the others, but it also may not be the fault, their own fault. I mean, if you are 65 years old and you experience dementia, it's not really your fault. So it's very important that we speak of healthy aging even in terms of people who are technically defined as not healthy. Keeping no one behind is that healthy aging policy needs to include all older people, irrespective of their health status. Healthy aging must not have a strict medical definition, medical in the sense of acute care. Once medical interventions have to be different depending on various aspects, one of which is age. And whilst when we are young, health tends to be tackled in acute healthcare premises, most hospitals, and community care. In later life, we need another wedge, which is the intermediate care. Because when you are 75-year-old, You might not, I mean, your partner, your wife, your husband may not be as strong as when you were 30. So you need intermediate space whereby you can regain certain aspects, like for example, strength in your hand, like personal confidence, like sometimes even learning how to walk again. Rather than a complete discharge and quick discharge from hospitals to the community, to one's residences. We have to look at also the issue of rehabilitation. When we're young, we rehabilitate ourselves relatively quickly. Our body, when we get older, tends to take more time to rehabilitate itself. Specific example, a bruise. A bruise will take longer to heal when one is older. And so intermediate care, a space between the home and the acute hospital setting, and also rehabilitation. But when we speak about later life, when we speak about chronic health problems, when we speak about mental health issues like confusion, delirium, dementia, we have to speak about care management and not acute care. So we have to understand that we will not be able to cure. So communication becomes important, becomes central, because how can you manage care without communicating well? Because when we provide training on healthy aging, it's not simply what this drug does, but also facing the person when you speak to him. So it's a very multifaceted way of working. It's a field where basically there are so many things to reach if we want to reach active aging that it's always a race against time. There's no magic wand, of course, but I think we need to focus on voice. We need to let aging people, because now we are mostly focusing on aging people rather than older people, we need to hear their voices out. We need to understand, empathize with them, because it's one thing saying that we want you to be healthy, and it's another thing if they are working 16 hours a day. So sometimes we give conflicting messages. We want you to exercise, but we don't give you enough time to exercise, not we, or the employment situation doesn't give you enough time to exercise. Or else, for example, we ask you to exercise, but then there's no space where to exercise, or knowledge sometimes. So we also need to have health literacy classes. When one organizes health literacy classes, they need to be organized in a way that older people may actually participate and understand what's going on, and in a way that they feel empowered. The older we get, the less the top-bottom approaches work. Any educational learning environments have to be done kind of on a parallel, in the sense that the facilitator has to negotiate, has to discuss, has to empathize, and the older we get, the older person will have even information and knowledge to teach the facilitator. So it's like the opposite way that young people learn. So age-friendly also communities is something that we need to start thinking about. It's very difficult to have a full-blown community and then make it age-friendly, but things has to start from the beginning. So if we want to have a healthy aging environment, we need to mainstream aging. We cannot have the Ministry of Health being very much aware of healthy aging, but then the Ministry of Transport not being aware of what necessitates a healthy aging environment. So by mainstreaming aging, I feel my advice is to have what is generally called an interministerial committee, council, that looks at aging in different areas. Because if you are ministry responsible for roads, older people will walk through those roads. If you are the ministry responsible for communication, radio, televisions, older people are your clients, are your viewers. If you are the ministry, even for education, I mean the older people also have a right to engage in informal and non-formal learning. So I think that is how we can achieve a truly healthy aging scenario, whereby all different ministries who form part of the chain are conscious to what is required for older people to age in place as possible, because healthy older people live in the community, or they live in the community as much as possible. And we know that some would need to take residence in long-term care facilities, and that's something normal, but our challenge has to keep older people living in the community as long as possible. I think COVID taught us that that we didn't achieve as much as we thought we achieved. In what sense? In the sense that previous to COVID, we thought that older people had the skills, were empowered, were could decide, and then COVID came, and all of a sudden we realized that many older people could not take part in the online world. Many of the people could not travel except on public transport. So when public transport kind of became limited, they could not travel. We realized that many of the people lived in houses which were not really accessible, and so they were almost imprisoned in their houses for months. In emergency situations, or very few emergency plans took into context vulnerable people, including older people. If you look at COVID, the people who fared the worst were vulnerable people, like women who now had to work and take care of their children, persons with disability who, of course, found that their lives now were contained, and older people as well. So looking forward, again, I think the possible solution is in mainstreaming aging. When we do any particular plan, even if the plan is about gardens, we have to think that older people will visit these gardens. If we're going to build a ferry, we have to consider that older people will be coming on this ferry, and they may have walking difficulties, mobility difficulties, they may have dementia. So science, for example, needs to be larger, than usual. We need to ensure that everybody is included. A significant majority of older people do have challenges, mobility challenges, physical, cognitive challenges. And I think a truly inclusive society in this sense would cater also for these older people, whether in times of COVID and post-COVID.